Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense.
Welcome back to the Equine Vet Connect. I am your host, Dr. Caroline Brown. Dan is still gone, so we are doing our own thing. Woo-woo. I've got with me Dr. Tori Martin and Dr. Caitlyn McCaulley today. Hello. And we are going to do some trauma bonding.
Yeah.
And we're going to talk about internship experience. So all three of us did internships. Dr. Tori did 2 internships because she's extra crazy. But I think it's something that's super important for, veterinary students to think about, whether they want to go into private practice, whether they want to go into a residency or whatnot. What is an internship and why do we all do them? And do you need to do an internship? Mm-hmm. And,
what kind of internship do you want to do?
Exactly. There's a lot of questions when it comes to that. And, I think for a long time, the internship was kind of just the expectation for equine medicine. It was there was no question about it. You had to do one, regardless of what your goals were. And
it was like an unspoken requirement.
Yes.
Yeah.
And so now it's a little bit different. There's some other things that have kind of come about, like that get away from doing an internship. But I'm like, when you read the descriptions of it, I'm like, it sounds like just an internship, just with a fun name. But we'll dive in and talk about each of our experiences and things. So Dr. Caitlyn, why don't you start us off?
Sure. So I did a private practice internship at Southern Equine Service in Aiken, South Carolina. I chose to do that internship mainly because I had a really good externship experience there. And I thought at the time that I wanted to stay on as an associate after the internship. So I was like, what better way to get my foot in the door and get some extra experience than by doing the internship there. So yeah, I did that. I did think about going back to do an internal medicine residency for a little while, but I kind of shifted my priorities and decided against that. But yeah, so I did a private practice internship for a year. It's a pretty big practice. I think at the time there were 12 doctors before interns, so 15 total with the interns included. And yeah, that's what I did.
All right, Dr. Tori, what about you?
So as Dr. Caroline mentioned before, I did 2 internships. So I started out out of school at a private practice internship down in Weatherford, Texas. It was equine sports medicine and surgery. I really enjoyed that internship. It had its hard points, but I also had a ton of exposure to things that I really enjoyed doing. And then because I was intending on pursuing a surgical residency, I decided to go and do an academic internship afterwards. And my position was kind of unique. I ended up at Purdue University, and my internship was actually split between a clinical internship and research position. So a little bit different, but still had the kind of academic internship experience there.
Mm-hmm. So in your case, because you did both a private and an academic, what do you think is the big difference between the two?
They're so different. Well, they're so different.
Or what would you say, I guess, is the advantage to doing one over the other?
Yeah, so and it does depend on where you go. So whether it's the private practice side or the academic side, there's going to be variability in some of these things as well. But generally speaking, private practice is going to see many more cases in a day compared to academic. So just general caseload and case responsibility is going to be higher in a private practice internship. You also are then an intern. Generally, there's a few practices that have residents, but you're an intern under a senior clinician, as opposed to in an academic, you're an intern under a resident under a senior clinician. So you're always reporting up to somebody, but in a private practice, you may have a little bit more ownership of your case in comparison to a residency. and compared to an academic due to the fact that they have a residency program there. Now, at Purdue, for example, on surgery rotations, that was very much the case. But on medicine rotations, as an intern, you are also taking primary case responsibility over your cases, depending on the case and what we had in hospital. Another difference is the pace. So you're working up a lameness in academia, you're starting that one at 9:30 in the morning, and you're probably not done with that case until 3-something in the afternoon, because if you need a radiograph, then radiology team comes down, shoots the radiograph. You have to go through kind of all of the channels with all of the different departments, which it's so great to have access to people that are so specialized in those departments. But in private practice, you need a radiograph, you go, you grab your generator, you shoot your radiograph, you move on.
Takes a long time.
So there is different kind of levels of responsibility, and there's a lot more of a caseload and I guess more of a hustle, I felt like, in private practice comparatively. But that's not to say that you're not, busting your butt in academia as well. And some days you have emergencies coming in left and right. And if you don't have a designated emergency service, like some universities do, then it's whoever can pick up whatever and keeping the ball rolling. So lots of, that's like probably the most significant differences, but there's so much more we could add to it.
So, and then kind of getting into it, you talked about, just basically what an internship is. And I'd say kind of the defining thing is that you're working under somebody, and it's, you do have some opportunities to kind of, head up the case and take it. But for the majority of it, you are working under somebody. So
you are fully licensed though. So
yes.
An internship in veterinary medicine, an internship is not a requirement. It is something that we choose to do. So you get out of school in veterinary medicine and you are licensed, you are ready to go, you've passed your boards, like you can go out and practice if you choose to. But an internship is something that we choose to do to further our training. Usually it's a year long, but it's not a requirement to do general practice. If you want to go and do a residency or get your specialists certification, you are basically required to do an internship.
Yes.
But it's not like in human medicine where they are required to do internships, fellowships, residencies, things like that.
Right.
So it's a little bit different for us. It's something that we choose to do.
So, segueing into that so perfectly, Dr. Caitlyn, let's talk about why did we all choose to do an internship instead of just going directly into practice. I think for my experience, I also interned at Southern Equine, so Dr. Caitlyn and I were actually roommates there when we did our externships as students.
Yep.
So I completed my internship the year before Dr. Caitlyn, but in my experience, I felt as I was getting ready to come out of vet school during my 4th year that just based on the experiences that I had had in vet school, I did not feel like I was confident enough to go out and start immediately practicing on my own. I think one of the big things in equine medicine that makes us different from some of the other, branches of medicine, mostly small animal, is that a lot of times we're on our own completely. We're in the field, in a truck, on somebody's farm, and it's just us. Maybe you get a technician or an assistant. You might have a doctor that you can call, but you can't always guarantee that they're going to answer the phone or that you have reception to call anybody. And so I think for me it was, I want to be in a place that I have almost guaranteed somebody above me that I can talk to and get advice on for cases, and I can, kind of build my own confidence when it comes to, managing things and building my skills and doing these things. Like that was my biggest thing when I was getting into it, and I'm glad I found an internship place that allowed me to do that in a way. And it's kind of a nice buffer, I think. Like, I think you're allowed to kind of figure out how you want to do things, and yes, there's still consequences to things. You still have to follow the standards of care and all the things, but you are allowed to kind of figure things out at your own pace and not be completely responsible for all the things that will go right and go wrong with a case.
Yeah, and you have someone to say, hey, I think that we might have a better idea by doing it this way. You are allowed to to make mistakes.
Yes.
In terms of your decision making, because you have someone that is really the final say.
Can swoop in and save the day.
Yes.
Be like,
Yeah.
maybe we do this.
Yeah, for sure.
I would agree with that. I think when I came out, like I said, I was planning to stay on as an associate there, so I, really wanted to get my foot in the door there and make an impression on the practice. But I think also I would agree with Dr. Caroline. Like, I felt like I was very strong in some aspects of practice, but I felt like I needed more repetition with certain skills. I needed more case exposure for certain things, and just kind of learning how to do it. Academia is very like ivory tower, gold standard of care. You have all of the things at your, disposal, and you have a lot of very smart people around you. Whereas when you're in private practice, a lot of times budgetary concerns come into play, and, you might not have a sterile surgical suite at your disposal. You've got to learn to stitch up a laceration with cleanliness in the field when it's dusty and dark, and so trying to kind of figure out that how to kind of navigate those changes and still practice really good medicine, but learning to be a little bit flexible in your like financial aspects of care, and also just kind of navigating that.
When you're also going to see different cases.
Yeah.
Like, what comes into the university is not necessarily what we see on an everyday basis.
Correct. Yeah. Because even, I feel like the university, for a lot of times they call them the tertiary centers, because it's the things that the people in the field can't figure out. And so, a lot of, you're seeing the zebras, basically.
Yeah.
And when I was in vet school, I felt like, I'm only seeing the colics that are so sick that they're getting cut.
Yeah.
But, the only other time I had worked up just a standard old colic with, just throw a little Banamine at it, was during externships at these private practices. And I'm like, I want to just be able to do that, because
it takes a long time to like look at a colic and be like, oh my gosh, it's not going to die.
Yeah.
Like, it doesn't going to be okay.
Need to go to surgery.
And what's amazing, like, just to segue, like, with the colic, like, and I've seen this in private practice and university, but I saw it both in internships, was you can have a colic on medical management refluxing for 3 to 5 days, and they can still resolve for medical management.
Oh, yeah.
Like, just because you're getting persistent reflux and very high amounts of it doesn't always mean that it's 100% surgical. But again, to your point, in school, you have a refluxing colic come in.
Yeah.
Again, I've seen universities not do that and treat them medically. It's not to say that wrong decisions are being made in academia and we're just cutting it because we can, but that is more often what you see at that level.
Learning to be able to push a case and
appropriately.
push a case appropriately to resolution is something that I learned in my internship. And it changes your perspective a little bit. For sure.
I mean, for me, obviously, doing an internship, if I wanted to do a residency, was then a requirement. But I had told myself that residency or not, I would do an internship, similarly to each of y'all, in that if I'm going to be the one making the decisions and running these cases, like, I want to feel fully confident and educated to do so. And my vet school experience was amazing, and everybody was required to do large animal, and we had options to do more large animals. So I felt very equipped to do equine. However, I am very much a learning by doing. Like doing things is what solidifies it. Sure, I hate to say memorize, but I can memorize the things to pass the test to move on. But what really solidifies it and makes me feel like I know what I'm doing and what I'm talking about is by having cases that I'm like, okay, that's how that progressed. That's how it goes. And so for me, it was just that push for the further education and making sure that I'm doing the best for my future patients by educating myself to a higher standard than just coming out of school.
Sure. And I think equine medicine in and of itself is so kind of specialized. They can't teach you everything you need to know in school. They can't show you every single possibility that you're going to see in school.
We see some weird stuff.
We do see some weird stuff. And we also see some normal things that are a little bit funny and you've got to kind of pick through, or multiple
Right.
things are going on. So I think the internship for me was also a chance to just get more exposure to everything before I was out there on my own and pull up to a case like, what the heck is this?
Yes.
So yeah.
Yeah. So how did you guys pick where you wanted to do your internships? Because if you scroll through the AEP sites
Yeah.
and look, there are so many internship places and and they all can sound the same and whatnot. So, I think it's important just to look at, they call them the red flags and the green flags
Yeah.
in practice. So, for me, I really wanted to do an internship at a place that I had visited.
Correct. I think that's
was
very important.
Yes, I was very hesitant with some places that they're like, oh yeah, you can apply for our internship even if you've never been here, because you can make anything look good on paper.
Yeah.
But sometimes it's getting into these practices for your externship and you're like, oh, this is very different than, maybe what they advertised or whatnot. And I had wonderful experiences at all of my externships. They all had, something really valuable that I learned. And, I had a hard decision, I think, when I was going to make my decision about where I wanted to go, just because I had such awesome experiences. But every place was so different. And so I think for me, it was kind of looking at, what are my goals? What am I trying to learn at these things? And the reason I landed on Southern was that I felt they had the most kind of diverse things.
Very
when I was
diverse, yeah.
They were very diverse in caseload. It was, you're seeing a lot of different disciplines. You're seeing a lot of different, economic situations. You're seeing, medicine, you're seeing surgery, you're seeing reproduction, emergency, routine stuff. I mean, you were seeing everything there. And for me, that was really important to get that, because I think when I was coming out of school, I didn't really know what I wanted to do. I wasn't sure if I wanted to go and pursue another residency or something down the line. I didn't know what type of practice I really wanted to do. I knew I wanted to do equine, but I wasn't really sure. So I was like, let me go somewhere where I can do a lot of different things and figure out what I like and what I don't like. And that's what I really liked about my internship experiences. I got exposed to a little bit of earthing, and I got to figure out very quickly things I'd like and things I don't.
Yeah. I think too, piggybacking off of that, I think it's very important to go visit places, but I also think while you're there, talk to the current interns.
Yes.
Talk to the associates that have stayed on after their internship. Just talk to everybody, ask questions, see what their kind of day-to-day life is. With the caveat being that while you're there as an extern, if they want you to stay on as an associate, you might get a little bit of a different story or a little bit of a different picture than, because everybody wants to paint themselves in the best light, which is totally fair. But just kind of keep that in the back of your mind too. But definitely go places and talk to people. I fell in love with Aiken. I loved Aiken.
Aiken's great.
It's awesome. It's a really cool place to be. There's a lot going on. It is the coolest place to be if you're a horse obsessed girl like me.
Yes.
So yeah, it's just a cool place. It was a great practice. But yeah, I think definitely I would agree, go there as an externship before you make your decision. Because when I externed in Texas, they had a really good internship program there as well. But I looked at what those interns were responsible for from a day to day, and just kind of the structure of their year, and I was like, yeah, not interested in that one. Yeah.
Yeah, I don't think I'm the best to give advice on this question, because I probably didn't approach this the way that I should have. I have no regrets with where I ended up. But, we should all share, because everybody gets there differently. So I had never been to my internship place before.
There you go.
Yeah. Neither one of my intern mates had visited Southern before they interned there either. So
basically how it went is I did some externships. When I chose my externships while I was in school, I chose one because I thought it was really cool and I wanted to go and see what it was like. And I actually would have loved doing an internship there had I not been so surgery focused, because they had 2 surgeons and then they were down to 1, and I think that surgeon even ended up leaving. They didn't do much surgery, so I didn't decide to go to that one or try to go there for an internship.
Yeah.
My other I chose one other externship for the sake of someone having a good internship experience there. And I actually, out of that, I was thinking that's where I wanted to do my internship.
Yeah.
And then my other externships I picked because they were going to give me a stipend for travel. So
That makes
I
it
wasn't
easier.
going to lose money going.
Yeah.
So I went.
Yeah.
And then when it came down to the choosing an internship or what to apply for and all of that, the one externship that I went to that I was interested in, I had sent my stuff over and I hadn't really heard back, and I followed up and they like didn't know if I had sent my stuff. And so it was one of those things where when I was there, I thought that they were really interested in me as an intern, but then when it was getting to that, I was like, what happens if they don't want me, if I'm putting all my eggs in this basket?
Right.
Like, I'm getting a little stressed about this.
Yeah.
And it really wasn't even that late in the process, but I felt like it was too late in the process. So I hopped on the AAEP website. It was Avenues at the time. It's much better now, but I scrolled through and I was looking basically at what kinds of cases do they see and how much are they going to pay me to be an intern, because you really don't make much money as an intern.
No,
Yeah.
well, we haven't even talked about that yet.
And so I came across equine sports medicine and surgery. Their salary was nice compared to the other ones. They had a lot of benefits involved, and I was like, I'm going to look this practice up.
Yeah.
It's in Texas. I've always wanted to go there. And I pulled the practice up, and I was like, wow, they really do a ton of surgery. I mean, Chad Marsh and Reese Hand are two very good surgeons that are part owners in this practice. And man, I even called Dr. Marsh while I was on my interview here about a case with Dan.
Yeah.
But I was like, wow, I get to potentially learn from these guys who are really, really good surgeons and do a lot of big work. They see a huge caseload, and it's very surgery, sports medicine heavy, like equine sports medicine and surgery.
Right.
Like, it's in the name. And it's in Texas, and they'll pay me decent.
Go for it.
So I called up my friend that was at the other externship that I really liked, knowing I wasn't going to intern there because they didn't do a lot of surgery. I was like, hey, do you know anybody that like did an internship here or knows somebody that did? And she actually knew someone that did an internship and then a fellowship there. So I got on the phone with her, and she enjoyed her experience enough to stick around for a fellowship, didn't get a residency, but then stuck around as an associate in their racetrack practice, their racehorse division. And so I was like, well, if she had a good experience, I can do anything for a year. I can do anything for 1 year.
Yeah.
And so that was how I made my decision. I don't know if that's the best way to make the decision, but that's how I made my decision.
Hey, but that's how you did it, and you're here now. So
Yes, it did work out. It was very hard at times. There were things that I was like, yeah, no, if I had known, maybe I would have. But there's also things I wouldn't trade.
Yeah, it's
So.
like that everywhere, I think.
That's one of the things too that I think is super important, is that there are going to be good things and bad things about every internship program that you do. No program is going to be 100% perfect.
Yeah.
No practice is going to be 100%
And it's going to be
perfect.
hard work.
Yes, we haven't even really scratched. So we're
into
gonna
that,
dig deep into that about what is it like for an intern at, and we're gonna specifically talk about our places because that's what we know. Again, every place is different, so I think it's really important if you are a student and you're looking into an internship, you really need to ask, what are going to be my responsibilities as your intern, because that is going to be exactly how your life goes for the next year. And it is not glamorous in any way, shape, or form, no matter where you go. If you find one of these cushy internships, congrats. But it is a lot of hard work. So at Southern, we rotated between kind of 3 different positions. We had the in-house person who was responsible for all of the in-house cases. There was always an associate.
That's interesting.
Yes. So there was an associate that had their name attached to each
Every
case,
case,
whether they brought in, for emergencies or appointments or, what have you. But we were responsible for maintaining all of their treatment plans, getting a lot of their treatments done throughout the day,
overnight.
right, and overnight often, soaping all of these. We were responsible for some of the client communication with these, keeping up with their invoicing, you know, watching them during the day, keeping the associate updated on what's going on with them, and all of that, and
also,
you know,
managing emergencies as they come in.
Yes,
things like that,
and you know, getting things going, and it's a lot of work. I mean, at Southern, we had 3 separate buildings where we had patients kept, and so there were days where you had 50 plus patients that were your responsibility to take care of.
And a lot of them, when we had that many horses in, a lot of them were quote unquote stable. So the majority of them were, you know, just there for wound care or reproduction or something, kind of more of like a boarding capacity. But there were probably anywhere from 6 to 10, maybe 15 of those that were pretty critical.
Yes.
At any given time.
Yes. You've got multiple people on fluids and, you know, CRI drips, sick foals. I mean, you were pulled in a lot of different directions.
Cases were all under one in-house branch.
Pretty much. Yes. Huh. So the other 2 interns.
They're so different.
The other 2 interns during that, there was an outpatient intern, and their kind of primary responsibility was working with our kind of the 2 owners of the practice who mostly operated in-house with lameness cases. So it was a lot of lameness, it was a lot of flexing and blocking and joint injections and things. And then they also kind of helped with some emergencies that were coming in during the day with things. So a lot of times you were kind of getting pulled into the in-house. It was kind of a floater position.
When I was there the following year, our outpatient intern was also responsible for running all of the anesthesia that week.
Okay, yeah, that was ours as well. So,
So we were helping with outpatient appointments, running anesthesia for surgery, managing the surgery patients until they recovered, and then they would go back to the in-house intern. But yeah, that outpatient intern was kind of a floater.
It was, sometimes you get sent out during the day to go run emergencies too in the field if things were crazy and they needed somebody. It was kind of a floater position. And then the other position was the ambulatory intern. And so twice a week you went down into the low country, where it was a lot of racetrack med, a lot of, just low country medicine in general, which is
it's an interesting.
It is interesting. You learned a lot on those low country days. You started about 6 a.m. and you got back at anywhere between 7 p.m. and midnight.
PM,
Somewhere in there. So it was a long day. It was a lot of learning, a lot of getting to do stuff, which was cool. It was a good experience.
But basically, you were, as an ambulatory intern, you were teching for your senior clinician, whoever you were riding with that day. You did get, like Dr. Brown said, you do get to do a lot on those days. Like we got to do joint injections and nerve blocks and, basically, if it needed done, we would do it. You get a lot of imaging experience on those days. Like I learned to take x-rays very quickly. And, those are very valuable experiences. But but then your ambulatory weekend was your off weekend. So
yes,
we
got that 48 hours was very precious.
Our structure was, when I was there, we worked for 19 days straight, and then we were off for 2 days, and then 19 days straight, and then we were off for 2 days.
Yes.
And so that was our lives for a year.
And we started taking emergency call probably about 6 months into the internship. So interns were responsible for all the holiday season. So Thanksgiving holiday, Christmas holiday, and then New Year's holiday. So we'd split those between us, and it was nice because everybody was pretty local. So most of them stayed in Aiken during the holidays. So especially that first time that you are like truly
by
the
yourself.
On-call person by yourself, there are other associates that were there to help us and, kind of bounce ideas off of, because, you're out there sometimes and you're like, I don't know what to do with this. But it was very stressful life. You are spending a lot of hours in the day. You're getting there pretty early, usually before 7 a.m. If you're the in-house person, you are there sometimes till...
Sometimes you don't go home.
Super late at night. Sometimes you get home, you're home for about 30 seconds, and then your phone rings, and you're right back at it. And sometimes you're trying to sleep, and something starts to crash at, 1 o'clock in the morning, and you're right back there. And ours was nice. We did provide housing for us, so we were less than 5 minutes from the clinic.
And I think that's important. Some things that I didn't like about other places that I visited was that their housing was on site.
Yeah.
And for me, I wanted to be close, but I didn't want to be on site because I felt like if I was on site, I would never truly get any separation or get any type of break. And so I felt like that for me and my like mental health, that was important to just have the opportunity to leave and actually leave.
Yes.
Yeah.
But yeah, that's the thing. Like, but even for me, even when I did leave, I still had cameras pulled up on all the horses.
Oh, yeah.
I'm
All the time.
sitting there eating my dinner, just
watching everybody.
On the cameras, just trying to see what's going on. And we were lucky with ours that we, most of the week we had overnight technicians, but there are some practices where you are the overnight technician. And so you are there taking care of things. If something's on fluids, you are watching it. If something needs meds overnight, it is you as the intern who is responsible for doing that.
Yeah. I think when I was there, we did have a overnight technician for the majority of the week, except for Saturday nights. That fell on the outpatient intern to cover treatments on Saturday nights. But I had been, to other practices where the interns did overnight treatments every single night.
Every night.
Yeah.
Yes.
Yeah.
So, all right, Dr. Tori, what about you? What was
It's
yours?
very different.
It's very different. See, very different.
So we had rotations as well where we had different services that we were on, and it basically was we had 3 surgeons and then we had ICU. So it was 4 rotations, 3 of which were the surgeons, and then you had your ICU, and that was kind of like your emergency as well. And so any case that was ICU was obviously yours when you were on ICU. Any case that you had, like that a surgeon had when you were on their service, whether that was in for rehab, whether that was in for surgery, regardless of what it was there for, that was your case. And we did have isolation as well. I don't know if you guys had isolation.
We did.
Isolation isolation was attached to ICU. So unless it was like a surgery that ended up in ISO, sometimes we'd pass it over and sometimes we'd keep it.
I'm just like having flashbacks to our ISO stall.
On average,
105 degrees in there at any given moment. So, wrapping up, because I'm pretty sure we could probably go on for
so much.
Another episode.
we could do a
about
day-long
this.
CE on
on
internships.
this. But I'd say, what in our parting words, what is your advice for a current veterinary student that is considering internship?
I think for me, like I said, I'm very grateful that I did it. I wouldn't change it. I think it taught me a lot. But I think definitely asking those questions when you're there as an extern and really getting an idea of what your responsibilities are going to be, what your day-to-day life going to look like. Because I didn't really ask those questions, and so I was kind of blindsided when I came into my internship. I knew it was going to be a hard year. I knew it was going to be a lot of work. And I don't regret it. I'm glad that I did it. It taught me a lot, but I think I would have been a little bit more prepared had I asked some important questions. Yeah.
I think from my side, like, it makes me think of one of my favorite quotes. That's the reason that most people fail is because they give up what they want most for what they want now. And so my thing is to be an advocate for yourself. And that's on the side of like what you're saying, that make sure where you're considering going fits with your needs and the things that you want out of that experience. But also, what is your end goal and what do you want to get out of an internship? Because the way I see it is, if you want exposure to a bunch of cases, you have to be willing to put in the grind to see a bunch of cases.
Yeah.
So kind of to that point, but kind of on the opposite spectrum of it is, you also have to advocate for what you want most, not just what you want in that moment. And that if you want to be really good at lameness, you're going to have to go do a bunch of lameness to do that. And internship's a great way to have that exposure.
Yes.
But it might stink sometimes while you're in the middle of it.
Like right now,
So-
I really might want to go to sleep, but my end goal is that I really want to be a good practitioner. So it's like I got to give up my sleep now to be able to see all those cases.
Like
and
you
that's
have to
important.
be an advocate for yourself on both sides. You
Yeah.
have to be an advocate for having the balance that you need to be successful and to be mentally okay and to be able to absorb what you're learning, but you also have to it's not because we did it, you do, but you have to understand the grind that goes with that.
Yes.
And you're more than capable of doing it. It's 1 year.
Yeah, you can
You're
do
more than
anything for a year.
capable of the grind.
Yeah.
Yes.
You can do
Even
anything
when
for a
it's
year.
even when it's hard.
Yeah,
it was
for sure.
It was by far the hardest thing I think I've ever done in my life was that intern year, just with all of the stress from that, and I had a lot of stress in my personal life as well that I was dealing with, but it was so worth it at the end. Like, I don't think I could have become the doctor I am without that year of my life. That was such a foundational thing, and I think I learned so much, not just skills, but I think just about myself and how I want to practice and how I want to manage my cases and everything. And it's, I would never ever go back and give that up.
For sure.
I think, you know, as a student, I think I had no idea what I thought I was getting into, and I think it's one of those things you really won't know until you're there.
Yeah.
But, you know, truly, if you asked me to go back and do it again, I would never do it again.
I had 4 full limb bandages on an ISO when ISO AC was not working. So I had to be gowned up in the middle of summer in Texas doing 4 full limb bandages, but it's fine.
Yeah.
So on average, there was one surgeon that generally had less in-house, but the others, on average, you have 12 to 25 patients every morning.
Yeah.
And then as far as our like on-call on the weekends went, is we'd have a surgery intern on call, and we'd have an anesthesia intern on call, and then, because there were only 3 of us, we also had a surgery fellow, but we all kind of were operating similar to interns. The difference was how much primary you got on your on-call, like if you had a doctor over you or not.
Yeah.
So, and then one person would be off. So the downside was we did have some anesthesia techs that would occasionally take an on-call weekend.
Yeah.
So if you're the surgery intern on call and you have an anesthesia tech on call, you are now responsible for every single horse on the property.
Okay.
Which I had responsibility for 76 horses.
Yep.
So that became a lot sometimes, and I'm having to, there was some variability on, are we soaping and doing treatments, and all this has to get put in the computer.
Yes.
Yeah.
Soaping and doing treatments versus our techs going around and doing
Discharges,
treatments after we've soaped them, and so we did have good help from our techs, but there were also times that we were starting elective surgeries at 9 o'clock at night because we hadn't gotten to them earlier in the day.
Right.
And so during the day, you're on with a surgeon. It's anything appointment or surgery related. Like whatever they have on their schedule, you are their right-hand man for that. And then in surgery, a lot of times we'd have surgeries back to back. So if there's another surgery coming up, when you are done with the surgery, you recover that horse from anesthesia. The anesthesia techs start the next horse. And then as soon as you're done recovering, or as soon as someone can take over for you, then you scrub back into the next surgery.
Yeah.
And then you're obviously responsible for all the surgery reports and all of their treatment sheets. And so it's a lot. We weren't really doing the joint injections, but we were drawing up a lot of the joint injections. And there were times that we could get through, not with one surgeon generally, but in the practice, there were times I swear we did 30 to 40 lameness in a day.
Yeah.
And they're all getting injected.
Oh, that's
so.
Yeah.
It was a lot, and then we get into the spring and we full out mares. We filled out 167 mares my year.
Yeah.
And at that time, we fortunately did have a medicine fellow come on, so there were 4 of us to divide between. But when you were we then had someone on nights, and when you were on nights, you were if there were mares to foal, you were pretty much there, like the whole night, sleeping on property.
Yeah.
I filled out 4 mares in a night.
That fell on our in-house intern as well.
Yes.
That was they got to full out the mares as well. But we at least got to go home because we had the full alert system. So we were so
still
close.
had full alert and cameras and all of that, but they wanted us to be there.
To be physically there, So, sounds like across the board for all of us. You're the first one at the hospital, usually the last one there too. You're there at all hours of the day and night. You're sometimes up for 24 plus hours, no sleep. And it is a very difficult life. How did you guys manage your stress during that time?
As much as I loved Aiken, on my weekends off, I left.
Same.
I left.
Same.
I was in I guess it was like medium distance. It was 3.5 hours relationship. So I would leave. I would go to my now fiance's house and just get away, turn my brain off. But my intern mates and I, like, we would try to go get dinner when we could. We would watch a movie when we had downtime. Sometimes, like, we'd just get a pizza and we just go have, like, a vent session together and just, like, scream about everything and how frustrated we were and how tired we were. But also, I got to work on this really cool case, and, like, this is what I learned. And, like, you know, so just having that kind of support system with your intern mates, but then also having an outlet to go and get away when you need to.
Yes.
And also sleep. Sleep when you can. Benadryl was my friend. If I had a time when I could actually turn my phone off and go to sleep, I would pop a Benadryl to turn my brain off and just crash out.
I bought blackout curtains
Yep.
for my room.
Fans.
Yep.
Y'all, I didn't even need the blackout or the Benadryl. It could be bright as day and
Well,
I'm asleep.
that's my problem is, and I still struggle with this, is turning my brain off enough to
Yeah.
be able to actually go to sleep. Even though I was absolutely exhausted, like I would be worried about horses and worried about cases, and I still do this. So I needed the Benadryl. Knock me out.
I feel like I didn't really have a good solution for it.
Yeah. Yep.
Yeah.
That's very real.
Our intern class was not tight. We'd help each other out, but we didn't really spend a lot. Like me and one of my intern mates, like each of them, I think maybe in the entire year, like once or twice, but never as like a whole group. So
Yeah.
I didn't really have that.
Yeah.
I had my dog, and
Yeah.
me and my dog just getting to like lay around and
Yeah.
watch some shows.
I would not
and-
have made it through intern year without my dog.
Yeah,
So that's a very good point.
that was really
Yeah.
important to me, and I, went to some little coffee shops and bars
Mm-hmm.
in town occasionally, and I would, if I had the weekend off, I liked going down to like the stockyards because like I can go out by myself and talk
Yeah.
to anybody and have a good time. And
Yeah.
so I actually met these guys while I was out there one time, and they all lived over in the Dallas area. So there were a couple times I went out to Dallas just to hang with the guys.
Yeah.
Yeah.
But it wasn't frequent, so I don't know that that's really what like kept me going. But I also really I had a really nice apartment there, and I don't like cleaning, but I've always kind of been a domestic Sundays kind of girl.
Yeah.
So like I'll decide, okay, Sunday's my day that I put everything back together, and so
Yeah.
if I actually had a weekend off, then a lot of times Saturday was pretty lazy, but maybe I'd go to the grocery store and get things, and then Sunday I could like make everything look nice again and make
Yeah.
some good
Yeah.
food and have a nice meal. And
Yeah.
for me, food is life, and I
Yes.
like to cook, but I also like to eat. So I feel like that was kind of my way of kind of bringing myself back to center before another big
Yeah.
week.
Yeah.
I'd say that was probably my reset button.
Yeah. I'm a big meal prep person. I
Yeah.
always have been, and yeah, same thing. I've learned that if I'm not feeding my body, I'm not gonna work well. So like I really made it a priority to just try to meal prep, try to do things,
Yeah.
and that was a nice little stress reliever for me. Just to kind of give myself a little break from everything. And I did the same thing. I tried to get away. I was in a little bit longer distance of a relationship at the time. My then boyfriend, now husband, lived in Daytona Beach, so we'd meet about halfway. We'd go to Savannah a lot. He'd come up and visit me and just kind of help me with things around the house and just trying to have a little bit normal life. But that was a big strain on our relationship
I was
as well.
just gonna say, like, the fact that we both made it out.
Yeah,
is,
congrats to y'all.
It's hard. It's stressful for us, but it's also very stressful for whoever you are in a relationship with.
Yes.
Because it is a very long and very demanding year, and like I felt like the times that I was available to spend time with him, I was like a shell of a human because I was so
Yes.
tired.
We get grumpy too.
Yeah,
and
I
we
was
do.
so
It's
grouchy.
so grouchy.
as much as we want to spend time with other people, sometimes when you get the chance to, that's like the time that you're at the point where you no longer want to.
Yeah,
Right.
yeah. It was
I wasn't in a relationship for my internships.
Yeah.
I got one in the last internship.
Yeah,
But
it's a huge test to your relationship.
It
though.
is.
It really
Yes.
is. Yeah.
And I'm so grateful for my husband for hanging on with me there. There
Yeah.
was a moment after the internship where all three of us went on a beach trip, and all the boyfriends' husbands were standing there together, and they were like, thank God the girls are done with this, because this was getting so awful.
Yeah.
I mean, I just remember I would call him and I would just be like venting about this. I was like in tears just about this. I was so exhausted. I was so frustrated.
Yeah.
Like I could barely talk. Like I know his family was like so worried about me, like
Yeah.
just because I think we had Thanksgiving together, and like I couldn't speak. I was like, they are not allowed to ask me about how work is going,
Yeah.
because it's not going to be anything good to say.
So here's a question that's not on the list, but you made me think of it, so I'm going to throw it out there. Did you guys find it as exhausting as I did explaining internship at family gatherings?
Yes.
All the time.
Because
And like your
people
mom's
don't-
already explained it, but like people don't understand what that, and that for me was a hard part of the internship, was that nobody actually understood what I was doing.
Yeah.
Not because I held it against them for not understanding,
No.
but when you have to repeat explaining that 17
Right.
times,
Yeah.
and it still doesn't click.
And they're like, wait, so you're responsible for all of that? I'm like,
Yeah.
yeah.
And they're
then
like, "Are you a
some."
doctor? Wait, are you done?"
Yeah.
Like,
No. And they're like, and you're not getting paid really anything for it? I'm like,
I did
no.
the math. Sadly, I did the math because I hate myself. And
I did it too.
I racked up how many hours I was working a week, which was around 120-ish plus
Something like that,
plus or
yeah.
minus.
That's generous.
Sounds close.
Yeah. I added it up though. I had a little calendar and I was like, how many days was I here today? Like 18, 16, 24, 37. Like how many hours was I there? And I did the math and I was getting paid less than $2 an hour as a doctor, as a licensed veterinarian. I was getting paid less than $2 an hour. But like Dr. Brown said, we did have housing. So we had housing. We had all utilities included. So like that package was worth some money. For
You also
sure.
don't have time to go do anything.
Correct. So like, I mean,
it was all my like money just went to groceries and starting to throw money at my student loans. So.
Yeah.
But and the reason that the salary is so low is that you are not generating income for the hospital.
No, you are not.
That is the reason. So,
Yeah.
and because people a lot are like, well, I can't do that. I have to go make money after school. I'm like, I totally understand that. And so that is kind of one of the things I think that, in this transition into what we're doing now, where people aren't doing internships, is because student loans are so high,
Yeah.
and nobody wants to get paid
and
$2 an hour.
You can defer them while in internship or
Yes, you
residency,
can.
but then they're
So-
just going to continue getting bigger. I mean, I
Right.
did that. I'll be the first to admit I'm not always thrilled with how I handled it, but that's what I did because that's what I needed to do at the time.
Yeah.
and-
I feel like that student loans could be a whole
Whole
Ugh.
podcast.
podcast.
Yeah.
Just-
I
But
don't know,
yeah,
I don't know if I want to be in that one.
no.
stress. But yeah, I think, so I guess kind of going into the next thing and be like, how do we feel about our internships now? Like
preparing
as
us
we've
for-
come into where we are now. So like we're all now in private practice as associates. I feel overall that I am still very grateful that I did my internship. I think my biggest frustration with my internship came from I felt like I was there to learn, and I would get very frustrated, especially as an in-house intern, because I felt like I had so many responsibilities, and I felt like my internship was structured so that the hospital could not function without the interns.
No.
Yeah.
And that does not foster a very good environment for learning, because you are so swamped with everything that, like, I remember we as interns, like, we worked with one of the senior clinicians and we put this thing on the schedule that we were going to learn how to do a split bone removal surgery. And we were all so excited. We'd blocked it off on the schedule for like 2 weeks. We were so excited. I had my sterile gloves on for less than 2 minutes. and I kept getting phone call after phone call after phone call after phone call after phone call, and I had to leave that experience to go handle the 10 things that were happening because the hospital couldn't function without me for an hour. And I left that room in tears because I was so frustrated because I just wanted to learn something, and I lost that opportunity because that internship was not structured to run without the interns, which also meant you really couldn't take a sick day. You really couldn't take a mental health day. And I don't think...
Let alone vacation.
Let alone a vacation. Like that, I don't think is... I think that's something that needs to change in internships. I think that there's this train of thought that's like, oh, well, I had a really hard internship and I busted my butt for a year and I had a terrible experience, so you have to go through that too. It's like a rite of passage. I think that is starting to change, but during my internship, I heard so many times, well, when I was an intern, when I was an intern, I'm like, yeah, but look at this hospital now with 12 doctors and 2 buildings and,
3 buildings.
3 buildings. This is a very different hospital than the one that you ran as an intern 10 years ago.
Correct.
So like I think as an internship program, being willing to sit down with your interns and being like, what is working for you guys, what's not working for you guys, what can we change, how can we shape this, because I think we have a responsibility, especially as this generation of equine vets, to look at our experiences and be like, okay, what was good from this and what can we change so that those coming after us have a better experience than we did. I think that that's the conversation that needs to be had, not so much treating it as like a rite of passage and a really hard thing that you have to go through. Like I think, yes, it needs to be hard. Yes, you need to learn time management and you need to learn to work hard and you need to have all these caseloads, but it's got to be a little bit more, I think we owe it to the veterinarians coming through to actually have time for them to learn in a more manageable way.
Yeah.
Well, and it is vet med. So like there are going to be long days and there's going to be a week that you're like, wow, I really haven't. Yeah. But I mean, for me, coming out of my internships, both private practice and academic, for me personally, private practice was definitely harder because the pace and the responsibility that was on me was more. Yeah. However, like personally, I wouldn't change a thing because of who I am today because of it. Yeah. I do echo what you say in that I agree with that. That was a big conversation when I was involved with AEP's internship committee when we were trying to kind of shift from avenues into our new program and kind of create guidelines. Like that was a big part of our discussion was we can't just say because we did it this way, that's how it has to be. Correct. Yeah. So it was really talking about shifting that mindset, but obviously you can't make every practice jump on board with that. So I do echo what you're saying. However, I also, like personally, I'm very grateful for having done mine and how they have made me able to do what I do now. I think the biggest thing for me now, since I'm just starting here and this is my first associate position, is it's going to be an adjustment being the final say. It is. Like I'm more than confident, more than comfortable. I know what I'm doing. I know what I'm talking about. I know how to manage a case because I learned from all these cases. Yeah. But I'm so used to, well, this is what I would do with it, and then going to someone and seeing what they're going to actually do with it. Yeah. Yes. As opposed to being like, well, this is what I would do with it. Oh, well, that's what you are doing with it. Correct. Yeah. So that's going to be the adjustment for me here for sure, is getting out of the intern mindset of being like, oh, well, I think we should do this. Right.
Because again, you come out of the internship with all this experience. They
so much
say
knowledge.
That they say that in internship, you're getting anywhere from 3 to 5 years of experience in 1 year, depending on where you are and your caseload and everything, which is awesome. But like my biggest thing was I had never like long-term managed cases, because once they left the hospital, usually I never followed up with them unless I happened to be with the associate that was seeing them that day. Yeah.
Yeah, because you're on a different service.
Because you're on a different service, or you're with a different doctor, and you don't get to see that long-term follow-up. So I'm like, now, I've been. Today is actually my 3-year anniversary of being here. So yay! But I'm like, I've had patients since week 1 that I'm still seeing for cases and long-term things, and I think that was one of the more difficult kind of, mountains I had to climb going from intern to associate. And I like being in a practice like this where I do have other doctors to work with. I don't know if I could have gone into solo practice straight out of an internship, because again, I'm like, I'm just like, what do I do?
And that being said, like I have a lot of classmates and friends who did go straight into an associate position after graduation. They've done well. I have friends and classmates who did do an internship and then went to associate practice, and like they've also done well. So you can do it either way. It just really depends on what, what's important to you and what you want to do, and
and some people learn better being thrown to the wolves and being like, that was actually one of the things I kind of liked about the externship, that like had they had more surgery, I definitely would have gone there. Is that an intern there, they were doing all of the emergency stuff. So it was, here's your truck, make it how you want to. You can have a tech, you go do it. But they always had
you got a tech?
Yeah, I was gonna say.
But they always,
that's the other thing we didn't talk about.
They always had somebody to call.
I am so grateful that I had the internship experience I did. I think it very much made me the doctor that I am today, and I couldn't have become that person without it. I learned a lot about myself. I learned a lot about the way I want to practice and how I want to manage cases and everything, and I just...
You can also learn how you don't want to manage
cases.
Exactly,
because it's, there was so much foundational things in that I would not ever go back and make a different decision. Would I do it again? Absolutely not. I don't know if my marriage could survive another year.
To go back and do it another time over after getting to this point, maybe not. But I wouldn't change that I did
I wouldn't change it either.
Absolutely not. No.
And I don't want people to listen to this and think like, oh, don't go there. Like, we're not saying that at all. Like, I learned so much, and I am so grateful. And I think that, where Dr. Brown and I interned, they have since changed a lot of the structure of their internship for the better, because they did sit down and have those conversations with us, and they have changed some things. So
because the practice grew a lot,
it grew a ton
in a very short amount of time, and it's still growing, and which is amazing for a practice. But you have to make change at times, and they have, and for the better, and I think that's awesome. But I think we just kind of got the brunt of it. we were in the transition period.
It's also hard on the practice side too, because there's a little bit of a stigma, which some of it is true, and some of it I think is overblown a little bit. But there is a stigma that internships are terrible. And so people don't want to do them. And if you're used to having 5 interns, but you can only get 2,
that's a struggle.
Then the practice, it's not because the practice sets you up to fail. It's because they set it up for a 5-person system, and they couldn't get 5 people into it. So I think that's the thing too.
Because you even mentioned, Caitlyn, that you're like, this hospital cannot function without interns, and that is the reality of these major practices, is that their entire foundation is structured around interns.
Because
and so
it's like,
the secret is that most of these practices need an intern more than you need them. So
well, and it's true.
I don't know
because
if I'm allowed to say that.
Well, it's true, because if a tech called out sick, it was like, oh, we'll just throw the intern in that role. Or like I had to cover overnight shift for a week because our technician got sick, and it's like, I was happy to do that. Obviously, the horses needed to be cared for, but that's not why I was there. And so I think just for these hospitals to just have a better backup plan, I guess, than just throw the intern there. But yeah, I think overall, internships are very important. I think they're very helpful. I am so grateful that I did mine. I'm so grateful that I had the experience that I did, because it really did shape me into who I am today. I always laugh because, like, when we have a really busy day here, or everything goes to crap, or everything's trying to die, I'm like, well, you know what? My worst day here is better than the average day in my internship, or more manageable than my average day in my internship, I guess. So
and you're probably more equipped now to manage.
Exactly.
Yes.
Like, I do not panic in an emergency. If I have 3 things that are going on at the same time, I'm like, I can triage that. I am not stressed at all. I'm like, we're good. We got it.
We've done 10 times worse than that.
Exactly. So like, it really does set you up for success in private practice. It really does shape you into a very capable doctor.
I'm really excited to see how I
man.
feel a year from
Yeah.
now.
Yes,
Since now I'm starting the associate
Because
part.
we are a little bit more removed from it than you
Yeah.
are.
Yes.
So we've had time to process and think back on it, and it's a hard year, but man, it really is several years of experience rolled into one, and it is absolutely irreplaceable. Like you cannot duplicate that in any other way.
No.
Yeah,
So.
It's not for the faint of heart.
it is not.
It's not for the faint of heart, but if you can make it through that, you can make it through anything.
For sure.
You really can.
For sure. Yeah. So,
all
well,
right.
good deal. We could, if you guys are interested in a part 2 and we can talk more about like day-to-day life and experiences and things like that, let us know. We're happy to chat about it.
Or if you have any specific questions
Yeah.
you want us
Yes.
to get into,
Because we
then
could
we're
go
happy
on
to-
We
for
could go on.
a long time about this.
and we do take students here
Yeah.
at this practice. We love hosting students. We all
Yeah.
love teaching
Yeah.
and doing things. So if
I think
you
we
are
like
a vet
to pay it
student,
forward too.
yeah, if you're a vet student and you are looking to get some experience, come hang out with us. You can reach out to us on any of our social medias, and we'll get you in this practice. We'll show you a good time and
Yeah.
show you it's not all that bad.
It's not.
Vet Med is fun.
is fun.
We'll tell you about all the good and the bad, but
Yeah. Yeah.
we love teaching here. So
Yeah.
hit us up. Thank you guys for tuning in today.
Yeah.
And we will see y'all next time.